me and co-workers, and Dr. Naeimi. It's a broad overview of AI in dentistry and the use cases of artificial intelligence in dentistry. As you know, AI has changed all of the areas of research in recent years, and it's essential for dentists to know at least the research interests of globally done research. We have divided the use cases of AI in dentistry in several dental softwares, but first I will give you a brief history of AI in medical. For the first time that AI was introduced, it was by McCarthy, and it's around 50 years ago. Then in the 70s, it started to come into medicine first, not dentistry. But in recent years, especially from 2017 or 18 or from that part, it has gained a lot of attraction in dental field also. We want here the term machine learning a lot in research areas in dentistry about AI. And machine learning is a subset of AI. And it's related to the ability of computers to learn from human beings. For example, when a clinician diagnoses several diseases or puts effort into treating patients, the computers can learn from the procedures that the clinician is applying, and it can be individualized very well. Among different AI algorithms, convolutional neural networks or CNNs are very popular. And the reason for that is that because us dentists use a lot of image data. We don't have that much text data, and we don't use that much text data. The majority of data which is used in dentistry is images, like OPGs, PAs, and Python. First, we go through the applications of AI in periodontics. As you know, periodontitis and other gum diseases, they are multifactorial conditions, and they need different inputs. If different inputs are needed for the clinician to diagnose much earlier. And as you know, early diagnosis of periodontic diseases is very important to prevent illness. Another interesting research that was done is analyzing the salivary samples from patients and giving them the copy numbers of the bacteria that was present in their saliva. Computer could diagnose what kind of disease they have. In endodontics, there are four major research areas. First is pain prediction. As you know, in between endodontic sessions that they perform RCT, the patients may experience pain. But one part of it is because of the treatment. Other factors may play a major role. By getting that data from the patients and feeding them to our networks, we can predict the pain with high accuracy. As you see, Jean et al., they predicted post-operative pain with 95.6%, which is unreachable for dentists, especially humans. Morphology of the tooth is very important for us in order to provide another other procedures, and it can be understood better with help of AI. Also, locating the minor form for filing and for cleaning the canal is very important because you need to have the working. And the very interesting thing is that to assess the working length, you need to find the canals in the clinical dentistry. But now with the help of AI, we can predict the length of the canal, the working length, with high accuracy just based on the radiograph. Also, researchers have diagnose VRS, vertical root fractures, with help of CNS, with very high precision of 93% on OBG. In the area of oral and maxillofacial surgery, very important research area that has been highly interesting recently is the detection and diagnosis of cysts and tumors. As you know, detecting tumors and cysts is very hard for dentists, and you need to have some kind of radiology visual because they are very much. But with the help of big data and powerful CPU, now we can easily detect tumors from each other. For example, OTC from other, which was a hard task in analyzing radiographic data. But now, with a simple code, you can simply diagnose segregate. Also, cleft detection has been done with the help of AI, high accuracy, and its importance is because of the fact that if we detect clefts soon and don't neglect them, treating them becomes much easier. Another area is classifying osteoporosis, and osteoporosis can be detected by computers by assessing the density of the bone on the OPG, which is hard for the naked eye to do that. But with the help of modern algorithms and technology, computers can easily assess the level of bone density on OPG. A key area of research for us was pediatric dentistry, because the future generation, the health orators of the future generation depends on the treatment that they receive during the childhood. A very important breakthrough has been reached by devising apps that can be installed on any phone, which run on AI, and with the help of AI, they can easily detect plaque simply by taking a picture at home by the parents of the children, which can be very helpful for remote areas that don't have access to dentists and for the low socioeconomic classes which may not have the financial means to go to the dentist in their area. Early childhood care is a very crucial condition that has to be detected early on, which is neglected by a lot of dentists because they won't pay attention to it. But with level of AI, it has been detected much earlier. Also, several dental anomalies have been diagnosed with AI, like major dental. The supernumerary should be managed before they cause severe problems for the patients because of their orthodontic needs. In prosthodontics, AI is still young and it hasn't enough applications, but in the field of implantology, it's used a lot. The important is that when you place an implant and when it fails, the clinician has to know the brand and the configuration of the implant in order to plan a sufficient treatment. But in the past, it was nearly impossible to clarify the brand name of the implant that was inserted in the patient's mouth without knowing the dentist would deep that before. But now, with the help of algorithms that have been devised, without any history from the patients or their dentist, we can detect and classify the implant brands, which may reduce costs to a very large degree. As during orthodontics, Landmarks play a very important role. But detecting the landmarks can be challenging in most of the cases that we have. Again, here algorithms have been used in order to identify landmarks with high precision, and also in determining the growth spurt. And as you know, that determining the growth spurt of the child is very important in order to base the treatment in a very timely manner. And also in treatment planning, AI has helped orthodontists to make decisions easier, because the very important thing for orthodontists is whether or not to extract the tooth in dental art. But it can be challenging sometimes, like if you want to do it or not. But it can work here as an auxiliary, very effective. With all the advantages that was mentioned, we still face some challenges in implementing AI in dentistry. And because the data that we have may be biased, because some of the socioeconomic groups receive dental care more than offer, and we cannot get all the data that we need. For example, lower socioeconomic classes won't go to dentists as much, and we don't have that much data from. Our limitation is processing power limitation. Computers have limited processing power, and in remote areas, we may not have enough access to the internet for this to work. So, algorithms should be devised in order to work with more efficiently and with lower power computers also. Another very important challenge is the ethical guidelines, because we are using a lot of patients' data. Right? The data privacy should be considered, and the strict guidelines should be devised. But there's a lack in this area, and we hope that it can be overcome. So, thank you for attention. Here's my contact if you want to have any questions.
Is there any plans for the lunch? Is there any question on this stuff? Any comments? No. Okay.
Oh. Did you publish your information?
Yes, I can show you the publication. And we are currently working on a new project. It's a clinical project. We are taking caries in the above the eye. And the paper is ready and it will be published. I have put the orchid code here if you want. Here is the publication.
Good. Okay. Thank you so much again.